Mr. Chair, members, Senate Bill 1600 replaces the requirements of any practitioner involved in the performance of an abortion in which a fetus or embryo was delivered alive with the requirement that any infant who was born alive, including an infant born during an abortion, must be treated as a legal person under Arizona law and have the same rights to medically appropriate and reasonable care and treatment. It requires any health professional who is present when an infant is born alive to take all medically appropriate and reasonable actions to preserve the life and health of the born alive infant. Any health professional who intentionally or knowingly violates the born alive infant requirements is guilty of a Class 6 felony. Failure to comply with these requirements also may result in unprofessional conduct and establishes a basis for civil action. With that, Mr. Chairman, I'm happy to answer any questions.
Members have any questions for Michael? Well, you'll be getting your steps in, you and everybody else. All back and forth. All right. Senator Shamp, Madam Vice Chair.
Thank you, Mr. Chairman. SB 1600 is about respecting life. The very last line of the Nightingale Pledge that I take as a nurse states, "Devote myself to the welfare of those committed to my care." Every patient I take care of, I am their advocate. I fight for their rights and their decisions. And when a baby is born, advocates are needed. Laws must be present to protect them. And that is why I run this bill, and I'm very grateful. I'm very honored. Thank you.
Fantastic. Madam Vice Chair, who do we have coming on up?
And I apologize if I mispronounce anyone's name. Nicole Sestaro. Hi. Please state your name for the record.
My name's Nicole Sestaro, Chairman, Senator. I'm the mother of Lorelei Sestaro. Lorelei was born May 3rd of 2022. She had trisomy 18.
We're going to need to, I'm sorry, and I know this is going to be tough, but we're going to need you to speak right into the microphone.
Okay.
And just everybody that is here, this is for the folks watching on television and on the internet, and that's not trying to, stop you here, but
Okay.
sorry.
Before the official diagnosis or any abnormalities were seen, we were pressured to abort her. We were told by more than one doctor that termination was the right thing to do. Because of this, we found new doctors. They promised us that they would do everything they could for her. They informed us that Lorelei would eventually need heart surgery, but no surgeon in Arizona would touch her. Too many doctors believe that babies born with trisomy are just not worth the effort or the resources, that it would just prolong the inevitable. Lorelei was delivered with no complications. For the first week of her life, we were told that she had no issues. She was feeding and she was gaining weight. On May 10th, they said that we would be able to bring her home. Out of nowhere. In the early hours of May 11th, her condition deteriorated. She passed away later that afternoon in our arms. It was a moment that no parent should ever have to experience. The doctors told us there was nothing they could do. We still don't know if they even tried. Early on, we had decided that Lorelei had already fought against every odd. She deserved the chance to continue fighting. It wasn't our place or anyone else's to deny her that chance, and we will never regret giving it to her. Lorelei was not a condition or an abnormality or an inconvenience or something that could be discarded. She was loved. She was wanted. Her life held immeasurable value. regardless of her diagnosis. No one has the right to tell me my daughter was worth anything less. Her life mattered. Thank you.
Thank you for being here.
Thank you very
Members have
much,
any
Nicole.
questions?
I'm very sorry.
Excellent. Thank you for being here and sharing your story.
Thank you.
Dr. Lance Holman.
Mr. Chairman and members of the committee.
Microphone, there we go.
Mr. Chairman and members of the committee, good afternoon. I am Dr. Lance Holman, and a board-certified OBGYN, and I want to share the story of a patient of mine that I hope that will illustrate the need for you to support this bill. In the summer of 1987, I was the OB for a young woman. Her pregnancy was completely normal until approximately 24 to 25 weeks. And at that time, she developed increasingly severe pregnancy-induced hypertension, which is also called toxemia of pregnancy or preeclampsia. She eventually required hospitalization, and her condition continued to worsen. She ultimately developed kidney failure, blood clotting abnormalities, and the ultrasound estimated that her baby weighed approximately 1 pound. The treatment for this condition is delivery of the baby, and most of the time, once the mom is delivered, she begins to recover. But by the time that we were in this position, the baby was approximately 27 weeks, and our ability to take care of these babies at that time, 35 plus years ago, was abysmal. It was terrible. The cure for the mom was delivery, but the delivery was almost certainly going to be consigning the baby to death. These were the cold hard facts in 1987, and there really was no choice as to what we needed to do. I did her cesarean section with neonatal staff present in the operating room. They immediately took over the care of this 15-ounce newborn baby. Mom slowly but completely recovered, and over the next several months, so did the baby, ultimately going home and thus beating all of the odds and all of the statistics that we had at the time. What is my point? My point is that our care for this baby at that time was state-of-the-art and the best that we can do. Our care today is immeasurably better. Yesterday's 27-week baby is today's 22, 23, 24-week baby. My other point is the care that saved this baby's life was not done by the OB. It was not done by me. It was done by the skilled nursery doctors and nurses who recognized what the baby needed and took care of those needs. These are the people that have to be available immediately at the time of a delivery.
You're going to need to wrap up there.
Okay. Most abortions are performed by OBs, and we don't know how to take care of critically ill newborn babies. My last point is this. Prenatal genetic testing gives us a diagnosis, but it does not tell us anything about the severity of the disease. A genetic abnormality can be from here to here. This can be a completely lethal situation. This baby may live a relatively normal life, and we don't know any of that at the time of a genetic diagnosis. So all of these babies deserve the best chance of life that we can give them, and that's why I beg you to support this bill. Thank you.
Thank you.
Thank you, Doctor. Members have any questions for Dr. Holman?
Mr. Chairman.
Madam Vice Chair.
Thank you, Mr. Chairman. Mr. Holman, what does a newborn baby go through when it's left untreated?
Mr. Chairman and Senator Champ, a preterm baby is going to, most of the time, have trouble breathing. The lungs are basically the last thing to develop, and so a preterm baby is going to have trouble breathing, and if there's not care there for that baby, it's going to basically be the same as if you or I suffocated to death.
Another question, Mr. Chairman?
Please.
Mr. Dr. Holman, have you ever delivered a baby that didn't survive very long?
Yes, I have.
And what is that like for the parents to be able to have some time, even if it's a short amount of time, with their child?
I think it's priceless. As this lady over here
Yeah.
has had to endure the question of did anyone value my baby, and did anyone do what was needed to be done for my baby. It's priceless to have. I mean, it's incredibly sad, but at the same point in time, it's priceless for the mom and the dad to be able to hold their baby and to see that care is being administered. Or if there is no care, at least just having the opportunity to hold their baby and know that they're surrounded by people who care about them.
One more follow-up.
Please.
Dr. Holman, for everyone in the room, can you do me a favor and explain to me what a slow code is?
I'll do my best. A code blue, which we see on TV all the time, is basically where our heart stops beating or our blood pressure drops or there's some crisis in our care, and everybody in the hospital runs to our assistance and provides what care needs to be done. That's a code. So a slow code is basically the concept where someone has determined that no matter what we do, it's not going to make any difference. If in an obstetrical setting, if I have predetermined that a trisomy 18 baby is not going to survive, a slow code would be, let's put on a dog and pony show for the parents. Let's, very slowly and inadequately do our resuscitation techniques, whether it's CPR, whether it's IV fluid hydration, whether it's medications. It's more of a facade than it is a real treatment. And so we could theoretically be left with a situation where someone says, what did you do for my baby? To me, there are ethical situations. If I say to you, your mother has breast cancer and I'm going to do my best to take care of her, you trust me to do my best to take care of her. Mm-hmm. I mean, that's my ethical responsibility. If I'm doing less than that, then I have lied to you. And that's wrong.
Or is there any other questions? Thank you, Doctor.
Thank you.
Thank you.
Next up,
Ron Johnson.
welcome to Health Committee, Ron.
Thank you, Mr. Chair, members of the committee. For the record, my name is Ron Johnson. I represent the Catholic bishops in Arizona, and I am here in support of Senate Bill 1600. I'm here because we believe in the dignity of human life from conception until natural death. Unfortunately, it is often the case that the most vulnerable people are the ones that need the most protection, whether it be the littlest children, the disabled, or the elderly. Often you hear people only speak of the protection of innocent human life from abortion, but in this bill, it applies to all infants born alive. After all, every baby born alive deserves basic medical care and a chance at life. Senate Bill 1600 will make sure that premature babies receive this care and not allow the killing of a baby, even for neglect. It is for these reasons that we encourage a yes vote on Senate Bill 1600. Thank you.
Thank you.
Thank you, Ron. Members have any questions for Ron? Thank you.
Thanks.
Nicole Forday. Bettina Bickle. Catherine Emerson. And I think our last is Bethany Miller.
Mr. Chairman, members of the committee, my name is Bethany Miller. I represent the Center for Arizona Policy. We're here in support of Senate Bill 1600. Just wanted to make a couple points. First, that Arizona already has a law on the books that protects babies born alive during the course of an abortion. So this bill is just expanding current law to ensure that all babies born alive have a chance at life. Even babies born early, babies diagnosed with certain chromosomal disorders like trisomy 18, which you've heard about today, even babies diagnosed with major and severe congenital anomalies or other illnesses with a high probability of death. The basic standard of care that's set out here is clear. It's just that medical professionals take all medically appropriate and reasonable actions to preserve the life and health of the infant who is born alive. This gives parents much needed and precious moments with their babies. It gives the baby an opportunity to respond to care and be comfortable, and it gives latitude to doctors while not requiring unnecessary interventions. Everyone wins with this bill. I especially just wanted to make the point that in a situation like Lorelai's that you heard about today, it would be such a wonderful thing if parents can know for sure and not be haunted with any idea that maybe their medical team didn't do all that they could for that baby. So that's what this bill does, is it gives parents that assurance that medically appropriate and reasonable actions were taken. It ensures the baby is cared for, and the doctors know clearly the standard of care for these situations. I'd be happy to answer any questions.
Members have any questions? Thank you for being here.
Thank you.
We have anybody else signed in?
Oh, Mr. Chairman.
Okay, members. Seeing as though we don't, is there any further discussion before moving the bill? Seeing none, Madam Vice Chair.
Mr. Chairman, I move Senate Bill 1600 with a due pass recommendation.
Members, you've heard that motion. Secretary, please call the roll.
Aye.
I would like to explain my vote.
Please do.
So this issue is very personal and important to me. I am a healthcare provider and I work in the reproductive healthcare space. As was mentioned earlier, there are already laws that exist to protect infants, and I think that those are important. I appreciate the compelling stories about what can happen in the medical environment, but there are real circumstances where pregnant patients are in considerable distress, often delivering a perinatal embryo that does not have any chance of survival. And I think that rather than having a grieving family in consultation with prayer and their own hospital clergy, in that moment the hospital has to intervene, even when the chance of survival is zero, and that's aggravating what's already a traumatizing situation. And sometimes those moments before death are the only moments that a family has to be able to take that in and grieve and have a peaceful moment. And I think that forcing medical treatment in a futile situation is more of a mandatory futile medical treatment measure, and not something that's designed to protect, because that measure already exists. And so I vote no.
No.
Aye.
Mr. Chairman, may I explain my vote?
Please.
A civilized society never denies medical care. Denying medical care is neglect. Arizona law should never allow for the killing of a baby. And with that, I vote aye.
Aye. Members, by your vote of 4 ayes, 3 nays, 0 not voting, you have given Senate Bill 1600 a due pass recommendation.